County Health Department officials now confirm a cancer doctor treating patients at Missouri Cancer Associates in Columbia has tested positive for COVID-19. Department Administrator Jim LeBaron says Dr. Mark Velick tested positive upon returning from a recent trip to Africa. KRCG 13's Mark Slavitt says health officials now are working to ensure Velick's patients self-quarantine for the next 14 days.
Columbia Dr. Mark Velick told Adair County health officials he started experiencing symptoms of the coronavirus Thursday. Velick took a test at a Columbia drive-thru. Velick called all the patients he had been in contact with Thursday to let them know about his positive test. Velick has patients at Columbia's Missouri Cancer Associates and Kirksville's George Rhea Cancer Center. Velick and his traveling nurse are now in self-quarantine. Health officials say the coronavirus is very dangerous to cancer patients.
With cancer, that their immune systems could have issues anyway. We're going to contact all those patients, and we're going to tell them to stay at home for 14 days, and that they need to monitor if they have symptoms. We need to have them monitor their temperature and stay at home.
Velick is self-reporting his positive test. The Missouri Department of Health and Senior Services has not released an official report on Dr. Velick. Missouri Cancer Associates is an affiliation of Boone Hospital Center. Hospital spokesman Ben Cornelius would not confirm Velick's positive test because of privacy reasons.
He made a phone call and was telling those patients that he was positive, and so we're wanting to talk to all those patients.
Health officials encourage anyone who recently had contact with Dr. Velick to contact their local health department.
CDC continues to remind people the importance of hand washing and eliminating germs during this time. KRCG 13's Alexi Petrovich joins us live with more.
Yeah, absolutely, Megan. The CDC recommends that people first and foremost, if this is an option, wash their hands with soap and water for at least 20 seconds. However, if you don't always have soap and water accessible, they recommend resorting to hand sanitizer. But they want to remind people that it needs to be an effective type of hand sanitizer. So among the things to look for when you're out to make sure that that hand sanitizer fits the criteria listed by the CDC, you should check to see if it is between 60 and 95% alcohol. Those are the most effective hand sanitizers at killing germs. They say to follow the label on those sanitizers to make sure you're using the right amount, and say to make sure that it's fully dry on your hands before wiping them. They also remind people that hand sanitizer may not be able to remove harmful chemicals like pesticides and metals. They also say sanitizers are not as effective when hands are dirty or greasy, and say to use soap and water if possible in those situations.
The Jefferson City Medical Group is asking anyone who can sew to help out right now in mid-Missouri. Laura Foltz, the Jefferson City Medical Group pediatric chair, says making masks can be easy and can help go towards their emergency stockpile. Foltz says the CDC only suggests using fabric masks in a crisis response, but they are looking to be prepared. She says they could be using multiple masks on some patients and seeing a number of the masks get used every day. For anyone willing to help, Foltz says it is as simple as going on YouTube. And to drop off completed masks, there will be a bin located behind the JCMG Stadium Medical Building near the outpatient surgery center entrance.
First mask might take you 20 to 30 minutes to make, but after that you can usually get one done in about 10 minutes. This is the front, which is one piece of material, and the back, which has a little slit in it, as you can see here, in order to put a filter of some type that we would be putting in a JCMG.